Thank you. Right, today I am just presenting two very simple things. It's the risk of endophthalmitis when patients wear face masks, and also when they put moisturizer or skin cream on their face. So I will just take you through a few slides to open a discussion and to bring this to your awareness. I don't have any financial interest. So let's firstly look at the hazards of patients wearing face masks. As you have all experienced as ophthalmologists, when we're examining patients in clinic, their glasses steam up when they are reading the visual testing chart. So what can we do about that? Well, I think what we might do is ask them to hold their breath when their glasses go on, and then work out which is the lowest line they can read, and just say that rather than talking and going from the very top of the chart. We also have difficulties with our 90 or 78 diopter lens steaming up. And also when they're having their OCT scans, the OCT lenses can also steam up. And of course, with the steaming up, we're also contaminating all these lenses. Now, when we're giving intraocular injections, the breath, which is from the patient's pharynx, is now directing to the operating field. So we have to be careful. And same for cataract and other intraocular surgery, that the patient's breath with all the bugs can be misdirected to the operative field. Finally, I think some people are aware, and most people are not aware, that post-operatively, let's say we have done a phaco and the wound is self-sealing. However, it is not completely sealed in the initial period. So if we ask them to put a mask on straight away, there is also a theoretically higher risk of endophthalmitis. If you look at different masks, they will have different construction. Now, in the olden days in the UK, we had these straps. And what we can do is to tighten the upper straps a lot more and loosen the lower ones so that the breath can come from the side or underneath the chin rather than up to the eye. You will also see that in good quality masks, there is a strong aluminum strip here, which you can really shape to the nose very nicely, and that reduces steaming. And in a really high quality mask, again, you have a strip of foam here, which also reduces steaming. However, these masks are difficult to come by, and mostly we're wearing masks which have ear loops. You can see ear loops. So the possible solutions with regards to masks during the pandemic, well, higher quality masks if you have them. And then the other possibility is taping with a micropore so that the breath necessarily comes through the side and from underneath. And also we have the option of holding breath momentarily during fundal examination or when testing visual acuity. Now, I think in the UK now, we would say for intraocular injections and intraocular surgery, we say no mask for the patient during these procedures. And for post-op, it would be an idea, probably no mask for a few days or possibly up to a week. Say if you've done phaco surgery and the eye is patched with a gel net and an eye pad, then they can still wear a mask until the following day when they remove the patch. And then maybe they should stay at home and not go out because it would be a good idea not to wear a mask for a few days. So that's about masks. Now, what about moisturizers and skin cream? So I have, after so many years as an ophthalmologist, 30, 35 years, I realized that some patients have not been instructed adequately, and they have been using skin cream, moisturizers to keep their skin beautiful and moisturized. The problem is with some of these cream, they are so slippery that you cannot put the drape on, it doesn't stick properly. It might stick partially and then come off. So here is an example. Look at this beautiful skin, and you think it's lovely. But actually, if you see a situation like this, you should tell them, please, have you used skin cream? Can you go and wash your face with soap and water and thoroughly dry before we mark the eye and start phacosurgery? So the telltale signs of moisturizer usage, firstly, you can see the skin sheen, as I've indicated to you. And the other thing is, now in the UK, we do mark the eye to be done. So when you put the marker pen on and you find that the ink doesn't stick and it just slides, you know that's another telltale sign. And finally, if you've missed that, when you're trying to prep the eye with povidone iodine, again, it washes off like water off a duck's back. You know you're in trouble. So what you do is, of course, patient education, very important. The earlier the recognition, the better, and just wash off with soap and water. Because by the time they've come to the operating theater and you send them away to wash, then you're wasting operating theater time. But it is still better to tell them to wash off and maybe do the next patient first before they come back. So those are some little things that I wanted to share with you during the pandemic. And I thank you for your time. And here are my email addresses if you wish to discuss anything with me. Thank you very much, Chairman.